Everyone, we're about to start the program. Please make your way to your seats. All right, this is as good a time as any to go. Good evening and welcome. I'm Susan L., Vice President and Executive Director of the Foundation for Barnes-Jewish Hospital. I'm so pleased that you could join us this evening for the Leading Edge Nursing Program. This is the Foundation's third Leading Edge Nursing Program, and we are thrilled to highlight incredible nurses from Barnes-Jewish Hospital and those throughout BJC Healthcare System, as well as our heroes in training at Goldfarb School of Nursing. You've heard from me before, and I'm always delighted to say that the mission of the Foundation is to enrich lives, save lives, and transform healthcare. And who would know more about that than our very own heroes, healthcare heroes, our nurses. I'm thrilled that Dr. Angela Clark, the Maxine Clark and Bob Fox President at Goldfarb School of Nursing at Barnes-Jewish College, and Dr. Angelleen Peters-Lewis, Vice President and Chief Operating Officer and Chief Nurse Executive at Barnes-Jewish Hospital, are joining us this evening as our featured presenters. If you notice, both their first names start with an A, so we have a double A program this evening, right? They are both tremendous partners and great friends of the Foundation. Now, before we begin, I would like to welcome each of our guests, you and those who are joining us online, including our board members from BJC Healthcare, Barnes-Jewish Hospital, Goldfarb School of Nursing, and of course the Foundation for Barnes-Jewish Hospital. Thank you so much, board members, for all you do on behalf of the Foundation, our hospital, our College of Nursing, and our community. And now, to introduce Drs. Clark and Peters-Lewis, please join me in welcoming Dr. John Lynch, President of Barnes-Jewish Hospital. John.
Thank you, Susan. Boy, it is nice to be here, and I hope we're getting into a routine, right, where we get together in person. Also, welcome to all of us, all of you that joined us through the miracle of Zoom or Teams or whatever platform we're using today. But it is nice to see you all. And man, has it been a rough 3 years for all of us. But no profession, I think, has been more impacted by our nurses, by the pandemic. And so it's been a very challenging 3 years for our nursing corps across the United States. And of course, I have a lot of experience with the nurses at BJH and across BJC. And as I reflect on my career and my interactions with our terrific nursing corps, I wouldn't be standing here actually without all the partnerships that and collaboration, and quite honestly, getting me out of trouble. I see Denise winking at me over the years that I've spent at Barnes-Jewish Hospital. Collaboration around new ideas and research, direct collaboration with some of the very best and some of the greatest, Tom Ahrens in critical care, Pat Potter and others, all from BJH, from Denise too, all our collaborations in safety and quality over the years. When I think about my lung transplant team, every one of my patients had a nurse, 24/7, pre-transplant, in the operating room, in the ICU, and on as they experienced the rebirth and recovery after lung transplantation. I would not be here if it wasn't for my collaborative colleagues in nursing. So it is my extreme pleasure to introduce two of my very closest colleagues to have a nice conversation with us tonight and talk with us about the stresses in the industry and in your profession. And more importantly, what are the plans ahead, right? So first, I'd like to introduce Dr. Angela Clark. She joined us in May of 2022 to become the Goldfarb School of Nursing President. Angie received her undergraduate and master's degree from UTK, UT Knoxville, right? That's the local way of saying it. Go Vols. And her PhD in nursing from University of Cincinnati. Before joining Goldfarb, Dr. Clark served as the interim associate dean and executive director of undergraduate and pre-licensure programs at the University of Cincinnati College of Nursing. do you want to come up now? Sure. And then Dr. Angelleen Peters-Lewis, who, as you all know, serves as my Chief Operating Officer and Chief Nurse Executive for about 3,500 nurses at BJH. I think she's on a first-name basis with most of them. She received her doctorate in nursing from Boston College and a master's degree in nursing from Northeastern University. Her postdoctoral work included executive nursing fellowship with the Robert Wood Johnson Foundation and executive leadership development at the Harvard Business School. Prior to joining Barnes Jewish Hospital, Angelleen was Senior Vice President of Patient Care Services and System Chief Nurse at Women's and Infants Hospital in Rhode Island. Angelleen, welcome. Take it away, guys.
All right. Thank you. Thank you so much. And
Thank you all for being here tonight.
yeah, it's great. We often have conversations,
Yes.
right, about where we're going, where we've been, and it's nice to have this opportunity. Also, by the way, we have these conversations very early in the morning.
Starting at 4:30.
Sometimes at 4:30,
Yes.
and we just talk about the excitement or things that we're working on or an idea that we have or an article that we read. And so it's really nice to come together and have this conversation
Together.
with a group.
We invite everyone into our conversation.
And also just to see the support from so many stakeholders of nursing, right? We're obviously all stakeholders of healthcare.
Right.
But to see so many people supporting nursing is just truly rewarding, and I feel very grateful to be here.
Perfect Thanksgiving gift.
Yes, it is. All right, we'll go ahead and get started. So after, as we think about the pandemic, there's been so much that's gone on. And nursing, as Dr. Lynch said, really rose to the occasion. And we do that in times of really tough times, right? And we lean in and we do that. And at the same time, while all that was going on, we saw a lot of compassion, a lot of caring, a lot of courage, right? And we also saw some pervasive inequities come through. So what I want to talk a little bit about to get us started is how do we take advantage of the lessons that we learned during the pandemic and really create the workforce of the future? And what does that look like?
And there was momentum created during the pandemic in that there was a recognition of the important role that nurses play in health and health care. And so how do we build on the momentum?
Yeah, we have to seize the moment. And in your presentation that you did for Pinnacle, your Pinnacle presentation in Boston, we worked on that and together to really be thought partners in that. And it was, how do we seize the momentum, right?
Yes.
Because the time is now and we have to really come together. And at the same time, we have to do what we haven't always done in nursing. We have to arm ourselves with data and evidence and use strategy and think about things differently than we've done previously.
One foot in the crisis and one foot towards the future.
Yeah, absolutely. So at the same time that we're talking about the future, we also have this looming moonshot. We need 1.1 million new nurses in the workforce in the next 8 years. That's our goal, right? That's our target. So I want to talk a little bit, we're going to be thinking about that and kind of keeping that up here as we're talking about how we come together to really address workforce, right?
Yes.
And I know from an education perspective during the pandemic, right, we have seen higher ed, and I have a lot of really impressive colleagues here, so just thank you for coming. There's educators in the room, our directors, assistant deans. There's so much that has changed in higher education and nursing, right? And we're going to go into what nursing education in the future looks like. But before we get into that, talk to me a little bit about what the pandemic has done to the workforce, some of the challenges that you've seen.
So the entire workforce, I'll speak specifically about nursing. What the pandemic did was really to expose the misalignment between nursing supply and the demand.
Yeah.
Also, it was very traumatic for our workforce when they saw all of the challenges of COVID. So when you think about trauma-informed care, they were really traumatized. They were caring for patients who were dying, learning themselves how to care for that patient population, and doing that for the last 3 years. So you can imagine the fatigue, the compassion fatigue that they feel. Also, there was this, we needed to tap into agency team members to join our teams. Yeah. And so that came with cultural challenges as well. As in addition to that, it drove up the overall cost of care. So that's about the nurse. But I want to elevate the conversation a little bit, because anytime we talk about nursing, we're talking about access to health care.
That's right.
Because without the nurse and nurses, it threatens access for just not regionally, but for our entire nation.
Yeah.
And then also it's talking about the cost of care, because if this misalignment between supply and demand persists, it will drive up the overall cost of care. And everyone in this room is a healthcare consumer,
right,
and cares about healthcare being accessible and cost effective.
Mm-hmm.
So those are the two big implications from the pandemic.
Yeah.
And then there's health disparities, right? The pandemic really exposed disparities in our population, and so it really has driven home the importance of nurses playing a role in advancing health equity.
Yeah, and it also has really shined a light on disparities in education, right? We're seeing a huge decrease in students from underserved areas going into college. Community colleges are declining in their enrollment, right? And we're starting to see that trickle down into the workforce, and it's going to impact us from years to come if we don't start to get ahead of it.
What are your thoughts on the biggest challenges?
So my thoughts, and really opportunities, right? I think what we saw is that the communities that did well during the pandemic, and especially experienced less disparities in minority care, what we saw was that they were closely aligned with an integrated academic health center. So an academic health center that had gone beyond the community health assessment and really partnered with nursing or providers or community health workers to get into the community and see what the needs of the community are, informed by the community. And they had those relationships set up. They were the first to be out there with their vaccine clinics, right? They were the first to get out there and provide education to families on what to do. And so we know that there's power in academic health centers. And we're also really lucky to be part of an academic health center. And the thing that comes with academic health centers that we don't often think of, or certainly I haven't when I'm trying to get grants, is we're actually very resource rich and what that does to the community. And it's not just the integrative care team members, but when we think about statistician, epidemiology, grant writers, researchers, what that does to really advocate for the needs of a community that's underserved to get resources there. So I feel like we saw the academic health center really come to light.
Let's talk a little bit about the academic health center, right? Because there's three missions that we have: to deliver patient care to most complex patients who need us most.
Yeah.
I think 4 parts to the mission, right? There's educating the next generation of clinicians, generating new knowledge for healthcare and for practice, and then serving the community. And nurses play a very important role in informing all of those missions. So when we talk about this misalignment between supply and demand, it really threatens the academic health center's delivery of their mission.
Yeah, I think so too. And to that point too, we also saw, this real need for a culture of value, and I think this has been something kind of underground in the workforce and in work environments, but the Macy Foundation commissioned a report on how do we eliminate bias in healthcare system, essentially in clinical training areas. And so we wrote a response to this because there's a lot that we have to be doing to make sure, we know when we align a population, right, that a population of healthcare providers that look like the community, our outcomes are going to be better, costs are going to be better, right? There's a lot of rewards that go in with that, but we have to make sure that we're supporting them coming into the workforce and that everybody feels a sense of belonging. And that's a really important topic that sometimes we don't think about in student settings.
Yeah.
And how does that translate then when we have new graduate nurses, or what that does to the full integrative healthcare team and when we're working with residents? And so it's very important that we start to really look at that.
So when you talk about the concept of value, one of the things that we usually challenge each other to do, we think about our different perspectives. And so you talk about a culture of value, and I talk about value from the lens of an operator.
Yeah.
And when I think about nurses and value, we shy away from the conversation about finances, right?
Yeah.
But value is very important, because if this misalignment continues and there continues to be an increased demand for the services and low supply, that contributes to increasing the overall cost of care. And then there are not enough nurses to help us think about how to deliver cost-effective care, and that's part of our role. We're concerned about social justice, so we want to have access. And then there's the role of the advanced practice nurse in helping to design those care delivery models that keep patients healthy in their communities where they live, work, play, and worship. And that actually is a more cost-effective healthcare model.
Yeah, and that really goes into what is the value of our nursing lens. And This is something that we hit on a lot, right? Because the nursing lens is very holistic, and it looks at a patient, but it also looks at the patient in the context of their environment, their community, the general population. So it brings a little bit of a different perspective, right? And we learned during the pandemic at times that that nursing lens was crucial to advancing policy to really increase access to care. And we were working on this book chapter during the height of COVID, and we were interviewing different leaders across the country and actually internationally. And one of the ones that we interviewed was a CEO of a major healthcare system, and he said, it's so, first and foremost, he's always a nurse, and it's so important that he uses that nursing lens to elevate policy. And that's something that we have to remember as we're working. And I think those are probably my biggest lessons learned.
And we talk about the nursing lens. Let's talk about that a little bit more, because what we talk about is this whole concept of social justice, how nurses view the role, caring for the whole person and interacting with the environment, skilled at developing relationships. Well, those skills are really transcending different industries. So we see nurses in very non-traditional roles now.
Yeah.
Target delivering healthcare, Walmart, helping design buildings for patient care. And that contributes to nurses not being at the bedside, which means we even need more, because that nursing lens can serve in so many different roles.
Yeah.
That's an opportunity. That's something to celebrate, but we've got to plan for it to make sure that we have enough nurses to serve wherever they're needed.
Yeah, I love this slide that you have up, by the way, and I would like just a little bit more, if we could go into the future of nursing 2020-2030 and charting a path to health equity and some of the content in there, right? I'm going to go into the education, but what does that mean for your workforce right now, and how are you using this?
So this is the second edition of the nation's strategic plan for nursing, right? The first one was 2010 to 2020, and the next one is 2020 to 2030. And what the nation is realizing is the important role that nurses will play in health and health care. So the 4 goals for this strategic plan to be accomplished in the next 10 years is to have an educated workforce that is ready to help us to advance health equity, meaning caring for patients beyond the hospital and their communities. And then as the patient population and care becomes more complex, that nurses will be prepared to do that as well. And as we think about technology and big data sets and the way that, precision medicine, which we're going to talk a little bit more about going, our nurses prepared to serve in those roles as well. And then the social determinants of health. Nurses are real huge social justice advocates in making sure the contemporary nurse of the future is able to integrate those components into the care that they develop. So exciting things for the future, and the national recognition of the important role we play across the healthcare continuum.
Yeah, and the nurses who contributed to this have just been incredible, right? Top leadership roles across the country and internationally, and it's just great to hear nursing's voice at that level too.
And we've got an opportunity to learn from many of them.
Yes,
so,
we have.
Yes.
Yeah, incredible colleagues. So we kind of went into a little bit about precision health. You touched on precision medicine. We hear about this a lot. Let's talk a little bit more about what that means.
Yes. So our physician colleagues have done a great job in precision medicine, the right dose for the patient based on their individualized biology, right, and their prediction about disease. But if you take precision medicine and you add to it the context of lifestyle, social determinants of health, how you interact with your environment, and data to predict what kind of intervention in terms of the social risk factors can help you, that can help keep you healthy. So that's precision nursing, and if precision medicine plus precision nursing equals precision health, then that's how we're going to keep the population healthy, decrease the demand on the acute care, and decrease the overall cost of care. So many different benefits from that approach to healthcare.
And to chart the path to health equity.
Yes.
And as I think about that and where we're at currently, right, increasingly complex healthcare system, right, we have to make sure that our curriculum is changing to really help develop the nurses that we're going to need in the future. And the previous slide in the Future of Nursing 2020-2030, they talk a lot about education and what we need to do curriculum-wise to get to where we need to be, right? So that we do have resilience in our workforce and that we've decreased stressors. So these are the things that we absolutely know that we have to do. And for my team members here, obviously recognize our strategic plan that's in here and how this aligns to our strategic plan. But we have to educate students to understand the impact of the social determinants of health. And this also means recognizing their implicit bias and what happens if we don't, right? How does this really relate to outcomes? We have to expand our experiential learning environments, and we have an incredible board at Goldfarb School of Nursing, and we're working with them to do just this, and I'm very excited about that. Care is not always at the bedside, right? And some of the most important care that we do has to be out in the community in non-traditional settings, as you previously said. And the other thing that we need to do is really work to develop interprofessional simulated experiences. The need for a psychologically safe environment when students are learning has become more important than ever due to some of the mental health that we're seeing with students, right? And I think it's important that we're working to get ahead of that. And also having a simulation lab that actually looks like our St. Louis community, and it's representative of the populations that we're going to be serving so that we're prepped and ready to truly serve those populations. We have to adapt to new technologies and lead digital transformation. As we think of, big data and AI, and what is that going to do? It improves the efficiencies of the healthcare system, and it also helps with education when we think about some of the opportunities we have. And one of the big ones is, I think of, we had the big resignation in 2020. And in 2021 as well. And then in 2022, we're starting to see this return of nurses to the workforce. How do we use technology to make the workforce and the work environment more flexible and adaptable to maybe the nurses' needs, right? And really elevate our autonomy and take that to a different professional level.
So we both have a paradigm shift happen in
Yes.
education, which we're going to talk about,
Yes.
and then in the practice environment, right?
Yeah.
To support the nurse so that they're doing many of these things. And it'll be a two-pronged approach, both educating the next generation of clinicians, which you're going to talk to us about, but also transforming the work environment to give our teams the time to do this work.
Yeah, absolutely. And you'll see policy on there and inclusive excellence, which we talked about, and integrative care teams. And the thing about integrative care teams that is so important in our work with HRSA funding has been that even students in our graduate program, so students who have practiced social work, counseling students, psych mental health nurse practitioner students, when we put them together in a simulated environment, the questions that they asked each other were astounding. And what we realized, we wrote this up and it's been published a couple different places, but what we found is that there are things that everybody thought each person knew, and nobody was getting an order for something, and the wraparound services completely dropped off, right? And when you're talking about a complex, comorbid, a patient situation and the potential impact that it's going to have on the family, and then not addressing resources, right? It just becomes compounded, so it's so important that we're really looking at these different levers.
Yeah.
And how do we expand them?
And teaching the team to work together.
And teaching the team to work together and creating a safe place to do that. And we haven't historically done that well, and I think there's a lot of opportunity for that.
So talk to us about how we're going to do precision nursing education differently.
Yes, this is exciting. I hope you can see this. I know the light's a little different, but this is, first, I just want to say, I think that both of us would agree there's so much that we do that's part of a larger team, right? This represents so much work, so many hours, a lot of thought partners. But when we've been talking about an enterprise approach to how we're going to address nursing and our workforce challenges, and where I'm at, we're having some enrollment challenges, and across the state we're seeing enrollment in nursing programs drop. And so it's, how do we really get ahead of this, right? We only have so many tools in the toolbox. Which ones are the sharpest? Which ones are differentiators for us when we have a limited pool? So this is our concept of precision nursing education, advancing health equity. And if you look at the top, those are the levers that we're really putting in here to try and change our workforce for the better and really elevate it. And then if you look at the bottom, they're a little bit reactive, and we're not going to get the outcomes that we want, even though we're still putting in a lot of effort, right? So what we tried to do was, what we did do was break this up, because both of us in our continuums have recruitment, development, and advancement. And my goal, and the goal of our team, is we had the opportunity to have full ride scholarships, right? No one is doing that for pre-licensure nursing. So we have full ride scholarships that comes with a work commitment. So we're now kind of going above this idea of we're curating our own workforce, the one that we need, that looks like the St. Louis community, right, that's going to best serve us. And so with the full ride scholarship comes a 3-year work commitment. So these students who are coming into the system then will have done clinicals in the BJC system. They will have been on the DEP units, and they will be acclimated to an environment that's a culture of value. And I think it's very important that we kind of continue to look at this on the spectrum of where we need to be. The other thing is we're continuing to see enrollment decline in the Midwest and certainly in Missouri. This gives us the opportunity to go out of state and bring in some students, say for example, California, who has a couple-year waiting list, right? We're also trying to align seats, right, with demand in programs. And so I just want to give one quick call out too. There's a new grad liaison position, which I think you're going to talk about in a second. But Dr. Carrie Kohler, who just took that position and began with us about 2 weeks ago, is here tonight to kind of learn about everything that we're doing. So it's exciting now to have another player and do something that's completely innovative to think about how we support people once they're in the system.
And made possible by the foundation.
Made possible by the foundation. So thank you so much. Yes.
And so Angie, and Dr. Clark, one of the things that we have to do together is when you accept that student, they become part of the BJC team right from the beginning, right? And then the precision part is moving away from looking at our encounter with students as offering them a job or an isolated clinical experience, but really talking to them about the lifespan of their entire career. And so being precise about and intentional about how we map that career so it's explicit for them. And then doing the education a little bit differently. So we have the dedicated education units where students come, they learn, they're part of the team, they have exposure to the areas that are important to them, and then we sit down and map a career out for them so they can see that they contribute across the health system, across the continuum of care for their entire career, right? And so that's the different approach that we have to take to students. Not an isolated job or an encounter, but we want to build a relationship that spans your entire career.
Yeah, and mentor.
And mentor,
we often overlook that part, and even bigger than mentoring is sponsoring.
Absolutely.
Right? How do we really get people the support that they're going to need to be successful in a really complex system? And I think that's going to continue to be a need for us on both sides of it.
And as we measure our impact, right, we'll be able to predict, hopefully, what kind of intervention each student needs to be successful and demonstrate some outcomes, both in terms of contributions to the health system, but more importantly, to patients, right? And as we design new models of care that we can test in the practice environment.
The patients, communities, retention, all of the things that are going to make all of us successful in advancing this path to health equity. And I think the other thing too that we often don't think about, but the health outcomes that we're really trying to change, right? It's also the nurses. And I think that's really important that we don't lose sight of that conversation as we look at what resilience is and what wellness is for an organization and what that does, and how important it is as we're seeing students who had been out of school for 3 years, some of them, right, and not in a traditional academic setting, now coming into a college environment, and what that does, and how do we meet them where they're at and really support them to get them up to speed of where they're going to need to be by the time they cross that line at graduation.
And we need a healthy nurse to do all the things you outlined on your last chart.
Yeah.
Right.
So we're well positioned to do this. Any other thoughts on how BJC is well positioned to really lead this change? Because we are doing that at a national level.
Right. And I think the things we talked about, mentoring, sponsorship, building career opportunities, be intentional about how you advance your career, and also this concept of thinking about nurses using their nursing lens across the institution, right? And so we can be thinking of them not just at the bedside, but maybe in information technology. There's so many roles, infection prevention, and really exposing them to the different ways that their nursing lens can contribute to patient care. And thinking outside about the box about that.
Yeah, and then also, you know, really making sure that we're getting our findings out there so that other people can be doing the same thing, because it's going to take a lot of us to get to that 1.1 million number. And so I think that's really important too. So we've reached out through connections to try and get on some of the really advanced work groups that are going on in the country on this right now, and have submitted some of this work and had really positive feedback. And it's fun to be part of that conversation, right? Because then we also get this kind of bird's eye view of things that are working and things that aren't working for other people, and then we're trying to employ that into our system and strategies.
And we need more nurses prepared to generate new knowledge, right? So it's great that we're out, but we want to ensure the next 10 to 20 years that there are nurses prepared to generate new knowledge that's going to inform practice, and that's going to be important work for us to do.
I think so too. So let's talk about, I know we don't necessarily want to go there, but let's talk about what the consequences are if we don't respond to the current nursing crisis, right? We think about, we spend roughly 17% of the GDP right on healthcare. We still have some of the lower outcomes of developed countries. And what else do we need to be thinking about if we don't get this done, if we don't pull together?
We're moving forward from the pandemic, but I think that was the best example, right?
Yeah.
Of not having enough nurses to care for the population, and the impacts on access to care, access to preventative care. And so those are the reasons that we have a sense of urgency, is because we understand that this is about the health of the nation, about patients. Anytime we talk about nurses, it's really about the impact that they play and the role they play in our healthcare system. So everyone here is a consumer of healthcare, and they want to make sure that if they need healthcare, that there is a nurse there to contribute. And more importantly, we need nurses to help keep patients in their own communities. And these disparities that persist, we want to make sure that we are able to achieve health equity.
Yeah, and we are the most trusted profession to do that, right? And when talking about who is going to lead the change in healthcare, that was a new poll that came out, and nursing was poised to do that. And there's a lot of nursing leaders in this room, and I'm really grateful for the path that you've paved for us to do this work. And I think as we look forward to the future, it is going to be continuing to arm ourselves with data and really making evidence-based decisions, and we're doing that in the curriculum as well.
And preparing the next generation to do that. Yes,
and that's really important.
So we always have a lot of conversations.
Yeah.
What do we want to leave our friends with today?
Our mic drop.
Our mic drop, yes.
My mic drop is that pathways into nursing are pathways out of poverty. And it's also a direct line of access back to that community. And that is something that we've streamlined, right? That goes both ways. And it's something that we've streamlined through scholarships that I think is changing. It's really, no one else is doing that. And then measuring it. And that's probably my takeaway. And then also, of course, the nursing lens. And that is what we're going to have to lean on to collectively pull ourselves together and change the narrative on nursing and where we need to be and what that will do for enrollment, right? When I think of the J&J campaign, where it was just nursing and how great it was in the 90s and 80% of nursing schools saw an increase in enrollment, we have to get back to that. So I think that's where I'm going to call on everybody here to really elevate nurses, right? And start telling the story of what we're doing and the impact that we have and the professional aspects that go along with nursing. Not just the clinical skills, but the professionalism of nursing. What about you?
With the support that I feel in this room, I'm energized and excited about the future, because I think as an academic health system, we are well positioned with our partners at Goldfarb and our partners at Washington University School of Medicine to lead the nation and to lead globally in advancing health equity, finally eliminating the racial health disparities or disparities that persist in any form, and leading this concept of precision health. And having nurses prepared to play their unique role in that, in any role across the continuum of care, and in any role from the boardroom, from the bedside to the boardroom.
Bedside to boardroom.
So the future is bright.
Yeah, I think so too. I know we're going to move to questions, but I just want to say on a personal level, I can't tell you how much I appreciate everything you've done for nursing and the conversations that we have. And different thoughts that we bounce off each other, and I just appreciate that.
It's been a rich partnership.
Yeah, it has. It has.
The two of us. Partnership and friendship.
I agree.
Thank you for both.
Thank you. Yeah.
So let's invite our colleagues here and friends into our conversation.
Yeah.
And it's not 4:30, so they get to.
Yeah.
Angelleen and Angie, if you wouldn't mind, whenever a question is asked, to repeat the question for our virtual audience so they can hear it as well, that'd be perfect.
Sure.
All right, go right ahead.
Hello.
Hi, Diana.
I really appreciate both of you today. Gave me some really wonderful insights into nursing. My question is, we talked about the new nurses coming in. What about the seasoned nurses that are there,
Yeah.
that have been with you and have seen some of the substantial financial benefits that the new nurses have had? What's being done with them to keep them, to retain them into our facility?
A couple of things. One is creating some value for the knowledge that they have. Two is making sure that they have an opportunity to get the new skills that we talked about.
Yeah.
And three is making sure that we have career advancement opportunities that recognize their skills and expertise. Recognize them in many different ways, right? Recognize them in ability to share more broadly, but also recognize them financially. So I think it's a combination. It's no one thing, but a toolkit of things so that they feel that they're part of this culture of value.
Yeah, and we're working with them too on the mentoring piece, right?
Yes.
Our students get so much support from nurses as mentors right outside, and I think that gives back to both, right? I know I professionally grow when I mentor, and I learn a lot from that, so we are trying to make those connections. The other thing, we were just in a conversation today about supporting students and some of the things that we need to do to help support students who are struggling in programs. And what we notice is that oftentimes our students won't ask for resources if they're underperforming. It's the students who are maybe overperforming or really concerned, highly concerned about getting an A, that are reaching out for additional resources. And those students who weren't reaching out were more likely to connect with somebody from a mentor collective that we work with, to get that assistance. So I think it's important to make sure that we continue to have those relationships with nurses in practice as well.
Yeah, and back to the seasoned nurse, how do we create the value proposition where they'll want to stay with us, right?
Right.
And one is really outlining different ways for them to contribute.
Yeah.
One is to share because that knowledge is leaving the bedside, but how do they inform the bedside? So putting them in positions where they can serve as a mentor, where they can be in our tele ICU, where they're watching and giving guidance and direction to our newer nurses. So really thinking about how to leverage the skill, knowledge, and expertise that they bring that is so important to patient care and the next generation of clinicians.
Yeah, and just one more thing too, because this came up last week actually in a conversation with Angel, but we were thinking of potentially, which we can do because of our reflexive relationship, is have a seasoned nurse who's practiced for a long time, who doesn't have an advanced degree, could still have a clinical group, could still come and educate, right? And how do we make those connections across BJC so we support that advancement in a non-academic way, but to really support nursing?
And we actually do that in our dedicated education units.
Yes.
So in our dedicated education unit, there's one unit on each service line, and the role of the seasoned nurses is to do a lot more teaching. So they have many clinical groups. I think it's one nurse to maybe 2 or 3 students, but they're really sharing their clinical knowledge and wisdom with the younger clinicians.
Yeah.
Thank you.
Thank you. Andrea?
So first of all, just absolutely wonderful presentation, and I hope that people in the audience are thinking about how we can help you, because this is going to be very important, whether it's a scholarship, but also become champion and ambassadors for nurses. I want to go back to your first slide of 1.1 million nurses, and I agree with you that we need a lot of nurses. But are there strategies that we can put in place to expand that recruiting pipeline? So I know, Angela, you talked about we can recruit the students from other states, but the reality is that 1.1 million as a nation, we are going to need it. So if we recruit somebody from other state, we create a deeper hole there. And I'm just trying to think in terms of information technology area. If we look at the growth of information technology area in our country, we are one of the leaders. We recruited talent from all around the world, and we created a pathway. Are there possibilities to recruit nursing talent from around the world? So Goldfarb School the BJC and jointly together, this academic center, it can become the magnet,
Yeah.
not just for our community, but for our nation.
Yeah, I appreciate you saying that. When we spoke last week and you had this question, it was an excellent question. And we often don't get this in nursing because of some of the challenges with practicing, even across states, right, for new graduate nurses, and which state are they going to get their license in if it's not a compact state. So thinking internationally is a little bit different in the pre-licensure, right? But I like the question, and then it brought us to really start to troubleshoot that with the talent acquisition team. So when we do have international students, how can we streamline visas and what's that going to look like? So our conversation last week has really kicked off a talent acquisition conversation of who do we need to bring in, and legal's involved now to really support them. For students who want to stay and provide care here, how do we make that happen? So I appreciate your continued partnership and moving that forward, your championing of international nurses, and I will continue to lean into our friendship for that, so thank you.
And then one thing to add to that is it will take us a long time to get to that number and close the gap, and so we have to be critically think about what is the care delivery model and who does what on the healthcare team. What is the true contribution of nursing and what can be done by others, and then we've got to accelerate the implementation of technology. Yeah. Because technology can be used to help the nurse be more efficient, right? Predict where they have to spend their time, and overall contribute to their work environment and the health of the care of the patient. Yeah. So technology is a big area that we have to discover too, and new roles.
Not just in roles too, even in how we're scheduling, right?
Yes.
And we do have a lot of nurses who, and we see this with students working as PCTAs also, right? They can give 4 hours, they can't give 12, right? Because of their current schedule. So how do we do smart scheduling and remove the nurse manager from that and really have people doing what they need to be doing that's patient-centered, and having technology do the scheduling, and that's going to bring people back as well. And how do we make our workforce sticky?
At BJC, we're calling that radical flexibility.
I love it.
Can you give an hour, 2 hours, 3 hours?
Yeah.
Different way to think than the traditional 12-hour shift.
Yeah, it's nice.
Great. We have a question back here, actually. There's a sleeping one, so.
Hi, Angelleen. It's Jennifer from Shared Governance.
Hi,
and
Jennifer.
I'd like to thank you for this opportunity to come see you, both of you speak, because it's been a pleasure to see what our strategic plan is to move forward to help with frontline nursing. My question to you is, as a person who is very much involved in the shared governance at Barnes Jewish Hospital, how can I, as a frontline nurse, come and talk to my department to help with this vision that you guys have? Because I find that it's a phenomenal vision that both you have. I'm at a point now in my career where I'm like, where do I go next? And so I came here so I could find out where could I go next. And so now, how can I take what you're telling me and tell my frontline staff and other people I see in the hospital, my fellow housekeepers who are like, what do I do next in my career? And how do they bring them to you and say, I think I've got a future nurse here. Can you help them get them to being a bedside nurse? Because I see so many people, so many great people here that say, well, I feel like I'm stuck.
Yeah.
You know, in housekeeping or environmental services, or even in, some of the entry-level jobs as a transporter. And how do I go from here to get to here? I don't know how to do it. I know I have all these things, but how do I talk to somebody about that scholarship that we have?
Yep.
And what tools can you give shared governance that I can pass forward to my group to say, this is the information, this is how you let people know?
Well, I always come to a good staff meeting, Jennifer, you know that. So we'll have to think more about two questions you asked. How do we communicate this down to the front line? So we'll have to think about that right after this meeting. And then two, being more intentional about career path across the organization and how we do that, right? So that not just for nurses, but for future nurses, how do we be more intentional about building career paths for them? And so we'll think about how to do that and follow up with you.
And the
That's a good
scholarships
question.
that are in place to do it.
Yeah, the
Because we do have students that are on those scholarships. I know Bright Futures was one of the ones that started that out, and we do have those scholarships available. So then also bringing that together of what resources are there to support, and then also with the full ride scholarships, right? How do we align that? Because we have kind of switched our model from the pilot, which is great. What we learned is that it really increased. Imagine this: you're handing out a scholarship, and then people want to apply at your school, right? So it really increased enrollment. So what we did was we switched from giving a lump of scholarships out to more of an advertised model and structured of 10 a term, so that we can really increase enrollment. So some of those are still available, right? And making sure that we're communicating that across the healthcare
Which is
organization.
what Jennifer's
and that's
highlighting, is the
great.
missed opportunity to
Yeah.
make sure that we're thinking about the pipeline within our own teams,
Yeah.
right, Jennifer?
Those are available.
And so that's what we want to be more intentional about, how we do that with our new grad liaison, and using maybe that role in a very different way.
Yeah, and I would love to come to that meeting too.
Yes.
I would always be happy to come and talk about nursing opportunities. Yeah.
I love the vision and agenda that you guys have put forth today. We can't miss the opportunity to put the physician leadership on the spot with Clay and John here. What do you need from them, and what do you need from the community to advance this agenda, make it happen?
I think we are really lucky in the sense of we have excellent physician partner support, and you're obviously here too, right? And I think that continue doing what you're doing and allowing us to be at the table and to have our voice and to bring that perspective. And for us, right, I think the other thing too is we're working very closely together to advance nursing research. And you don't often think about that from a physician-nurse perspective, right? That is huge for us, and that's going to make a big difference, not just for the community and the palliative care team, but what that's going to do to elevate Goldfarb and nursing research here in our community and how important that is. And then, of course, leaning into our WashU partnership. That's a huge recruitment tool for us. So I feel like we get a lot of support, and I really appreciate it. And continue that, please.
And I think we were talking to you about work environments. So engagement,
Yeah.
right, of your colleagues, and creating that culture of
Yeah.
value and belonging and value for their knowledge and contributions are things that you can do every day in your interaction with your colleagues to make them feel that they are an important part of the team, recognizing their contributions. And that's something that we're fortunate at BJC
We're
that
really
happens a
fortunate
lot.
to have that. And it was a draw when I came here, right? You don't often have a lot of physicians sitting in on your interview in nursing academia. And I had several. I don't know of the 51 interviews how many were physicians, but there was a few. So it's been a really supportive environment in that regard.
I'm sorry, Penny has a question here. She has a microphone.
Wonderful presentation, even more important, wonderful work. Regarding, there's so much that one could discuss or ask. Regarding this issue of increasing the supply of nurses, do you see opportunities that are practical and workable here in St. Louis to expand the pipeline, not just looking for people who will apply for scholarships, but working through both the public and private school systems to go back to the high schools, the junior high schools, even elementary schools, to educate boys as well as girls about the excitement and rewards of nursing as a career?
Yeah, it's a great question, and we're absolutely doing this. We have a full FTE dedicated to this right now. Dr. Terry Morris is working on this for us, and what we're trying to do is create pathways. And so we're partnering with lots of school systems in the region and in the 24 zip codes so that we can make sure that we are getting students introduced very early on to health professions careers and what they need to do to be successful to get there, right? Because we want to do that early so they're not taking extra courses. But we're partnering with them. We're also partnering with organizations like Girls Inc. to have them in during the summer break. And they're doing little week internships and learning about our sim lab and what nursing looks like and PCTA opportunities so they can be working to fund their education while they're interested in health careers. So we're absolutely working on those pathways. And our board has been instrumental in helping us make connections in that regard. And then we're also working with the community health team at BJC. Denisha's over the schools, and we've been working closely with her to kind of get additional leads on that. So yes, we are working on that.
And
If I could just make one observation. I believe what you're doing is potentially historic. I think that is worthy of understanding and recognition of this group. In reaching out to the community, you are aiding the cause of health equity.
Yeah.
That's not all that you're doing. You're aiding the health of everyone. And it's significant that academic health centers in this country, through the present, have never endorsed the mission or accepted the mission of improving the health of their community. In fact, only 10 or 15 years ago, there was a new dean at the University of Rochester School of Medicine who announced that his goal as dean was to make Rochester the healthiest community in the nation. And he was laughed out by academic medicine because our mission was the tripod, teaching, education, research. Community health is not our role. So this is really quite historic.
It's important for
I
our
think
mission.
could be innovative and path-changing for the nation as a whole.
Yeah.
So I would just underscore the importance of what you're doing and wish you the best in this endeavor. And I know that all of us here are, support you and glad to do whatever we can to help.
Yeah.
In terms of support, there's one other thing that everyone in this room can help us, which is the image of nursing.
Yeah.
Right now, the image of nursing to high schoolers and others where it may not be as attractive is the handmaiden to the physician, rather than providing care that's guided by our unique science and making a unique contribution to care. So the more that we can elevate the image and the contribution of nurses, that will help others to see it as an attractive career.
Yeah, and to change the headlines.
Yes.
What are we accomplishing as nurses, right? What are we giving back? What's our value add? How are we aligning ourselves with a value-based system versus some of the things that we're currently seeing in the headlines? I think that's going to be really important. I also really appreciate your comment and just thank you so much because it is good to hear that. Yeah, we'll talk. Yeah. Thank you.
We'll have to take one last question.
Yeah.
It'll be Penny here, and then feel free to ask all the questions you want as we resume our reception.
Thank you.
Dr. Dixon.
I have a couple of suggestions, possible suggestions for opportunities for you. When I was a young nurse, there was no such thing as maternity leave. We had to quit work. So after 5 years of experience at Barnes, I married, had 2 sons, and when they were both in grade school, after 12 years of being out of nursing, and I was singing the ABCs around the house, I thought, oh my, it's time I do something. So after 12 years, I thought, how am I going to do this? It happened that Barnes was offering a refresher program for nurses out of the workforce for a period of time. And we spent 6 or 8 weeks, and we had the opportunities on 2 different divisions. There were no ICUs when I quit work. There were 10 ICUs at Barnes Hospital when I came back.
Wow.
So I worked one of the divisions I picked was the respiratory intensive care unit. So I spent 22 years after I came back to work. Another opportunity would be volunteering. I spend every Tuesday morning for 4 hours at Evelyn's house. Thank you, Dr. White, for Evelyn's house. And Pat Potter and I bathe patients. And that's a wonderful opportunity if you can use volunteer nurses to do menial tasks of any kind. So, and thank you for all you all are doing.
Thank you,
Thank you, Penny, for being here tonight.
And thank you for continuing to support nursing. You've been a huge just a support and champion, and we really appreciate it. Thank you.
Thank you both. Dick Miles will now take the stage. Please stay and ask more questions. Angie and Angelleen.
Wow. We have these leading edge medicine and leading edge nursing talks for the community, and I've attended all of them for the past many years, and this is one that's most compelling, I have to admit. I agree with Dr. Lynch that nurses are critical to our future and the future of healthcare in our communities, and especially in this community. And I am very confident in listening to these 2 leaders who are terrific and in the future of our nursing here in St. Louis and our community, which is so important to us. I also like the fact that you're talking about leading the nation. I think we ought to be able to lead the nation in nursing. We lead the nation in a lot of medical areas, and I see no reason why we couldn't aspire to be a leader in nursing. So I'd like to thank Drs. Clark and Peters-Lewis and everybody else who participated in this talk tonight. I'm Dick Miles. I'm the board chair of the Foundation for Barnes-Jewish Hospital. It's been a privilege to hear from Angie and Angelleen. Your efforts in uniting to address the challenges, unprecedented challenges, that we face in our community and in the future is really inspiring. On behalf of all of us here tonight, thank you for your brilliant work and dedication so that more of our families and friends can look forward to a healthier future. Please consider sharing what you've learned tonight with friends and family. You can even share the video of this program, which will be posted to the Foundation's Facebook page and website soon. For those who are joining us virtually, please be sure to complete our survey on the right-hand side of your screen, because your feedback is very important to how we design these talks in the future. And for those who are with us tonight, please feel free to stay and have another cocktail or some food, and you'll also have the opportunity to chat with Drs. Peters-Lewis and Dr. Clark and ask them any questions that you didn't have that opportunity to tonight. So thank you again. Please stay well, and good night.